The skeletal muscle is a very large organ system, and it's responsible for 75 to 80% of glucose utilization or uptake, at least after a meal. Our organs, the muscles that we have, the fat cells that we have, they're not just mechanical weight or load. They're actually very living organs that they're very smart. They communicate with other organ parts. BMI is not everything. Now we look at waist circumference, which is a huge factor. I have yet to think of one thing in our life that would be worse if we exercise.
This is the Transformational Life Consulting Podcast with Deepa Grandin, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandin. I want to extend a special welcome to all our first-time listeners of the Time to Transform podcast. We hope you find the information we share here transformational. So, type 2 diabetes is exponentially increasing worldwide. Now, this increase is largely being blamed on the obesity epidemic. However, there appears to be more to this issue than just a person's weight, or something that's commonly used to assess a person's weight is the BMI or body mass index. And the reason the BMI is definitely not a perfect assessment is you can have several individuals with the same exact BMI, but the prevalence of type 2 diabetes in this population will vary. So there's so many other factors that we are still trying to figure out that actually drives one person over the other to have type 2 diabetes. For instance, we know that the presence of something known as visceral fat, so that's the fat around your liver, your heart, just your organs in general. And this is actually the more dangerous type of fat. So when we look at the South Asian population, for instance, they seem to have a higher percentage of this visceral fat versus subcutaneous fat, which the subcutaneous fat is actually more of a beneficial type of fat. So you can have a South Asian individual at a much lower BMI, but they have a higher risk for developing type 2 diabetes. And then when you look at someone, say, from the African lineage, they tend to have more subcutaneous fat and lower visceral fat, and they have a lower risk of type 2 diabetes, even at a higher BMI. So it's more than just a flat out, oh, this person has this BMI, so this person's considered to be obese, and so he has a high. So we really need to be paying close attention to what exactly is the pathophysiology, meaning what is the main driver that causes the occurrence of type 2 diabetes? So one factor which has been extremely fascinating to me, because I'm always looking for modifiable risk factors, given my own genetic risk for type 2 diabetes, and what can I do to prevent myself from going down the path of my parents? Now, we do have evidence that a lean or a lower lean skeletal mass, meaning if you have just muscle mass without a lot of fat, and it's on the lower side, this is actually a risk factor for type 2 diabetes because of increased insulin resistance, because we know that it is the muscle that takes up to 80% of the glucose that our body utilizes. So if you don't have too much of this muscle mass, your body, when you have a lot of calorie intake, your body actually builds resistance, especially from the point of view of your muscle, resisting the work of the insulin and absorbing glucose. So having a low muscle mass increases insulin resistance. So when we understand this phenomena, understanding that increasing your muscle mass is actually a way to counter especially if you have a genetic predisposition to increase insulin resistance, it's something that we can focus on. So for those of you who may not be aware, so if you think of insulin, so insulin is almost like a key that allows glucose to get transported into your skeletal muscle. When there's insulin resistance, it's like saying the key no longer works, and so glucose is not allowed to enter the muscle. And so when a person is consuming large quantities of calories and they're not exercising, leading a very sedentary life, the skeletal muscle volume drops. So you can imagine you have all this excess calories, which gets converted to something known as glycogen. So glycogen is just this very complex carbohydrate. It's just multiple molecules of glucose. It's just a way of storing all this excess calories. And then furthermore, you have the conversion into fat cells. So once you start having fat within the muscles, the muscle is more and more becoming what we call insulin resistant, just because the muscle is saying, hey, look, I have enough calories. I don't want any more. You can bring all the insulin in the world. I'm not going to respond to you. And now we know, that giving these patients more insulin is actually causing more harm than good. So insulin resistance really with the high insulin levels seem to be one of the major causes for driving an individual into type 2 diabetes. So you can imagine this is a very complicated topic and very complex topic. So in order for us to discuss this further, I have Dr. Maggie Chia. Now, Dr. Chia is a triple board certified physician in internal medicine, endocrinology and metabolism, and obesity medicine. She completed her undergrad and graduate medical education at the American University of Beirut before moving to the United States to complete her residency in Michigan. And later she did her endocrinology, diabetes, and metabolism fellowship at Loyola University in Illinois. She worked for several years at Mount Sinai Hospital in Chicago, where she headed the division of endocrinology and was the physician champion of the Diabetes Center for Excellence, as well as the Diabetes Service Line Director. In her current practice, Dr. Chia practices general endocrinology, but has a focus and interest in diabetes management, obesity management, as well as women's health and menopause. Dr. Chia, thank you so much for taking the time to share your knowledge on the association between lean muscle mass and insulin sensitivity. Before we begin, could you please tell us a little bit about yourself? What sparked your interest in the lifestyle-focused practice of endocrinology?
First of all, thank you for having me. I'm very excited to have this conversation with you about insulin resistance, and our musculoskeletal system, which is one of the fabulous machines we have in our body. So I am an endocrinologist, as you mentioned, and endocrinology is the study of hormones, how different molecules communicate with remote or distant body parts so that eventually the body can function as a balanced or harmonious system. But a big practice or a large part of my practice is taking care of patients with diabetes and obesity. And throughout the practice, you start noticing that most patients or many patients and many clinicians are not trained or aware or conscious or proactive about discussing lifestyle with their patients. So for me, you cannot really treat a patient without talking to them about their lifestyle and actually really giving them key points and tools that they can utilize to make their health better. And so that's why I felt like it would be an incomplete practice for me not to mention lifestyle medicine in my practice of endocrinology, for sure.
Okay, yeah, that's so important. Like you mentioned, I cannot tell you how many clients I currently have. They've seen their physician, they're in the pre-diabetic range, and all the physician ever tells them is, let's watch, wait and see.
Absolutely.
That's like the worst advice anybody can.
Absolutely.
Yeah.
You're watching and seeing it progress.
Yeah. And it's actually when they're in the pre-diabetes range, it's already pretty late. We know the pathophysiology with the hyperinsulinemia, because a lot of them don't even check insulin levels, and they're been very high prior to being seen. So that's really good to know, that how much you focus on lifestyle, because you've recognized the importance, because that's what got them there in the first place. So
absolutely.
So let's start with some basics. How does the skeletal muscle play a fundamental role in managing metabolism in the body?
So a lot of people believe that the liver, for example, is the main machine that utilizes nutrients, that filters, that cleans, etc., etc. But in reality, as you already mentioned, the skeletal muscle. So we have two types of muscles. The skeletal muscles, they're the ones that we can consciously move, and then the muscles related to our lungs, our bowels, etc., that function independently. So these are not skeletal muscles. So the skeletal muscle is a very large organ system, and it's responsible for 75 to 80% of glucose utilization or uptake, at least after a meal, following a meal. Now, the rest is in part utilized by the liver, of course, by the kidneys, the brain, the heart. The brain technically has a constant rate of glucose utilization, whether we're at rest, eating, not eating. But the skeletal muscle is really the main machine or organ. We're going to look at it as an organ that is responsible for utilizing glucose either during exercise, so you have exercise-induced glucose utilization, or after a meal and in the presence of insulin. So basically, you have these glucose transporter molecules that would go and sit on the lining or on the membrane of the muscle cells, and those bring in glucose into the muscle cell, into the skeletal muscle cell. And in case you're exercising, then that glucose would be used as an energy source. In case you're not exercising and it's postprandial or after a meal, then it will be stored in a way as a form of glycogen. And that is our skeletal muscle in relation to glucose, but it also contains our amino acids and proteins. So so when you're starving, or if we've been exercising for a long time and we don't have any more glucose resources, the skeletal muscle can also bring up protein or amino acids as a source of energy. And people who are very sick, we call them, catabolic. The muscle also delivers or provides protein or amino acids as a source of energy. So it's a huge energy powerhouse. And it plays a huge role in our insulin sensitivity and glucose metabolism.
Okay. All right. Yeah. So it's one of those things that, we tend to recognize how powerful exercise is, because it increases the insulin sensitivity in the muscle. And especially when somebody is doing like cardio in the fasting state, then they are really tapping into both the liver and the muscle in utilizing and increasing the sensitivity of insulin. So that's like such a powerful tool, both the fasting and the exercise. So how do individuals with type 2 diabetes, and you also see this in their relatives who haven't manifested type 2 diabetes yet, that they develop this insulin resistance in their skeletal muscle? How does that happen?
So first of all, I'd like to say that it's a very challenging diagnosis to make insulin resistance. We have so many patients who come to us to clinic stating that, doctor, I think I believe I have insulin resistance. Can you check it? To me, the way we check it in clinical practice, if we want to do it via labs, is we check an insulin level, a glucose level, fasting insulin and glucose level, and calculate what we call HOMA-IR, insulin resistance index. Right. But very often this is not accurate, in the sense that you can have a patient who clearly has insulin resistance. We have signs, the dark thickening around their neck, on the skin, etc. But the test is not always representative of the case of the patient we're seeing. So first of all, it's a little bit challenging for us clinicians to be able to quantify it, at least, even though we can recognize that it's there. But and even more so in patients with diabetes. A lot of patients with diabetes actually feel fine, don't have symptoms, and don't realize that there's something abnormal. But even early on, in pre-diabetes and diabetes, we have small changes that have a huge impact. So first of all, our insulin signaling is impaired. The cascade of insulin production, and as you mentioned, effect of insulin on the muscle cells is definitely impaired. You have increased fatty acids, whether it's in the blood or in the muscle and liver when we have diabetes. And so this lipid accumulation really impairs muscle function. It impairs it at many levels, like definitely at the molecular level, but even at the kinetic level. A muscle that has fat is not a muscle that contracts properly. So it's, there are so many vicious cycles inside this vicious cycle. You have impairment of blood flow. So patients with diabetes, for example, are very aware that their circulation can be affected, circulation to the eyes, to the nerves, to the kidneys, to the heart, but it's also the circulation to the muscle. So similarly, you don't deliver insulin properly to the muscles, you don't deliver glucose, you don't utilize it properly. There's inflammation. Diabetes is a very inflammatory state. So you have all these reactive oxygen species circulating in the blood, causing inflammation in the muscle, which really prevents the muscle from doing its function. There are so many mechanisms. Glycogen synthesis, so the ability to turn glucose into glycogen, the storage form that you mentioned, is also impaired with diabetes. So all of these factors directly affect how the muscle can help us utilize glucose in type 2 diabetes.
Yeah. And I think, the really important point you made about lifestyle, right? Because we are all, I think with traditional medicine, we're trying to mop, if you will, the floor where there's water leaking from the roof. And I guess the analogy I'm trying to give is all this excess calorie intake, which is root cause, is never being addressed. And we're just looking at all these really expensive mops to take up the water, fixing the leak in the ceiling, right? So I think just addressing the lifestyle where there's excess calorie intake, sedentary lifestyle, all of which is contributing to the muscles developing these fat cells and excess glycogen storage, and to the point the muscle's like, look, I have enough calories, I don't need anymore, and that kind of like pushes the insulin and causes the resistance, saying, I am not going to listen to you anymore. So
there's actually a disconnect, because as you just mentioned, the muscle is trying to say I have enough calories, but very often we have patients who have the belief that they actually cannot eat less. I feel dizzy, I get hungry. And this is partly driven by glucose fluctuations, right? In insulin resistance. And the patients have this sensation that they actually really need to eat, when in reality they don't. There's plenty of energy in the body. It's just stored but locked and not utilized properly. And so,
And this also reminds me of the gut-brain connection, how our microbiome is tailored based on what we're eating. And I have so many people, me included, I used to struggle with sugar addiction. And, when you are addicted to sugar, you literally feel like you have no control, and the food controls you. And it's not an imagination, because you've trained your microbiome to send those signals to your brain. So, I mean, literally, I would joke with, when I'm teaching courses, I'll be joking, like I could go to a donut or be in the mall and I'll feel like the donuts are calling my name.
Yeah, absolutely.
And it's really just because of the way I had trained my microbiome. And thank God that I detox myself. And now I actually do find myself thinking more about the salads and the fruits, because I've been training the microbiome to send those signals. And so then, we cannot overemphasize the importance of lifestyle changes. So Dr. Chia, one of the things that we notice as people age is that there is a tendency to lose muscle. We call this sarcopenia, and gain fat instead. So the sarcopenic obesity has been shown to also increase the risk of type 2 diabetes. So how does the sarcopenic obesity cause this increased risk with aging?
Yeah, so definitely as we age, with every decade, starting in our 40s, for women more than men, and probably earlier than men, we tend to lose our muscle. And it's for various reasons, hormonal reasons, our body composition changes, our estrogen, testosterone levels change, but also our lifestyle is a little bit more sedentary as we get older. It's just a fact. So mere aging, progressing in life, is associated, if we're not proactive about it, with a decline in our muscle mass. So if over the years we are losing our muscle mass, then we're losing that engine that we have that will be, utilizing the fuel, utilizing the glucose. And it's not just about storing glucose and utilizing it. It's also, and we might talk about it a little bit later, about the the molecules that the muscles produce actually in response to exercise, in response to food, that have so many downstream effects, right? So as we lose that, we're losing already the way we can utilize glucose. And then we're starting to store it in our fat cells, for example. So we've mentioned that skeletal muscle system utilizes 75 to 80% of our glucose, but as that shrinks, then more is being shunted towards the fat cells. We start gaining more fat, and it's not necessarily the healthy fat. It can be the visceral fat. Genetics, our family history, stress levels, so many other factors can help contribute to where the fat develops. But we start accruing visceral fat and subcutaneous fat, but the most serious one is the visceral fat, and we lose the muscles. And this is like the perfect storm for just causing more and more metabolic derangements, metabolic difficulties in dealing with glucose. So definitely, as we age, and if we allow the muscle loss to happen, we are increasing our risk of developing type 2 diabetes, for sure.
Yeah. So what lifestyle strategies would you recommend that someone can take to mitigate, this loss of insulin sensitivity, loss of lean mass as we age?
I mean, I think knowledge is power. I think people being aware and believing and accepting that we're losing our muscles as we age, but then also believing in the power that we have in restoring those muscles is fabulous. So I think it's not emphasized, or for years it hasn't been emphasized enough. I mean, so many times I've had patients in clinic insist that actually their weight is related to their muscle mass, when I would have the suspicion that no, this is actually probably visceral fat. Even if you can't see it, you cannot pinch your skin and feel subcutaneous fat. I know metabolically your body is acting like it has visceral fat. I get those patients on a body composition machine and show them your muscle mass is low, you actually have fat, you can't see it, it's more visceral, internal, etc. Yeah. So first of all, it's awareness, accepting. And then you have keys, you have tools. First, we have to train the muscles. We have to train the muscles for sure. Cardiovascular exercise or cardio exercise is really good overall for our well-being, but we need to build new muscles also. So resistance training in the form of lifting weights or doing some other form of resistance is extremely powerful in building new muscles, okay? Feeding the muscles so that you can form the new muscle cells. So we need to eat enough protein. Most of us don't eat enough protein. The past guidelines used to mention 0.8 grams per kilo of our body weight of protein, but that's probably an underdosing. So we probably should average about 1.2 grams per kilo of our body weight in terms of pure protein. And as we get older, or if we have a low muscle mass, we should aim at 1.5 grams per kilo of our body weight of protein per day. So separated throughout our meals, not in one meal, maybe like over 3 meals and a protein-rich snack. We really should be having protein at every meal. But we should look at our overall energy balance, right? So we can eat more protein, but we can't eat more fat with it or more carbs, etc. Overall, we should not exceed our energy requirements. The beauty with building muscles is that as you build more muscle, your energy requirements increase. So it's a non-starving way of actually losing fat. If we all stopped eating now, we'd lose muscle and fat, and we'd be losing weight. But what we really want is to increase our muscle mass, and that muscle mass will help us actually utilize our fat and glucose. So by exercising and eating protein, you're not eating less, you're actually eating things that are good for you. You're optimizing your metabolism, optimizing your muscle mass. People should always make sure they get their calcium and vitamin D, of course, supplemented. Focus on stress management, focus on sleep, because these are also big in terms of causing insulin resistance and overall like wellness, energy to exercise. But these are simple. They're simple, but it doesn't make them easy. They might be difficult because they require time, planning, dedication, but extremely powerful ways.
Yeah. What are exerkines and how do they help the entire body work in concert to communicate information about glucose and energy homeostasis?
Yeah, so I mean, I think people are quite familiar with endorphins, right? You exercise, you feel happy. It's these molecules you produce after you exercise that, go signal different parts of the brain and give you a certain, result. So exerkines are produced by different organs in response to exercise. So when they're produced by the muscles, they're called myokines. You have hepatokines, adipokines, all of these. Also, I always tell my patients that our organs, the muscles that we have, the fat cells that we have, they're not just mechanical weight or load. They're actually very living organ, that they're very smart. They communicate with other organ parts. And they communicate via these exerkines. They're kind of, and the exerkines work as hormones. They can go to other body parts and have an effect. They can act locally on the actual muscle that the muscle is producing. They can act on nearby cells. So exerkines are really signaling molecules that are produced in reaction to exercise. A lot of our exerkines or myokines produced in the muscles, for example, improve insulin resistance. They improve insulin binding to the receptor, glucose utilization, mitochondrial function, a breakdown of the fat inside the muscle, vasculature, right? Blood flow to the muscles. You have some exerkines that actually help transform white fat into brown fat. So brown fat is more metabolically active, increases our energy expenditure. So exerkines are a very smart tool that the body has to spread the benefit, if you want, of exercise all over our body.
Yeah, so I was actually reading also about the brain-derived neurotrophic factor that increases with the exponential increase while you're exercising, whether it's resistance or cardio. That plays a huge role in being protective against dementia. It's pretty amazing what these molecules do. And you had mentioned how powerful and smart our body is. And we don't even know the full extent of how much exercise. I mean, we keep harping, and I think for the longest time, everybody's been harping on the importance of exercise. But now when we are actually studying at the molecular level what it does, I'm still amazed at how powerful exercise is in preventing. Because I think in the olden times with our ancestors, being active was the way of life. You couldn't survive farming and lifting rocks or whatever. Now we have to go to the gym to do those same things.
Exactly.
So if we're not living intentionally, we're not using our body the way it wasn't created to be used. So Dr. Chia, how do exercise-mediated molecular events, and I know you didn't mention it, but in general, how does it influence the metabolic and functional properties of the skeletal muscles? And how can we apply this to treating metabolic problems?
Well, again, so for example, certain muscle cells would release certain exerkines in response to exercise. Okay, that increases locally the blood supply to that muscle cell. That increases locally the glucose utilization. That increases over time. That decreases your protein utilization when you're exercising. That helps you form new muscle cells. So, I mean, this is happening in so many organs at so many different levels. You have exerkines, for example, and we all know that exercise lowers our blood pressure, right? Exercise improves the nitric oxide production, which improves circulation throughout the body. Exercise through exerkines too, would improve our cholesterol profile, would improve our triglyceride levels. So there are at every muscle cells or at every cellular level, exercise triggers a cascade of events, signaling events. The mitochondria function better. We all know about epigenetic changes, right? Epigenetic changes, for example, are changes that we are born with our genetic profile, and we might not necessarily have mutations in our genes over time, but there are some factors that turn certain genes on and other factors that turn genes off. So exercise probably also induces epigenetic changes that causes our metabolism to be way more favorable, way more efficient, way smarter, way healthier. All these are mechanisms through which exercise and utilizing our skeletal muscle can actually decrease cardiometabolic diseases and type 2 diabetes for sure.
Wonderful. Yeah. Great points. So what consideration should we be providing to meal composition? You had mentioned the protein intake. How about timing alongside with when do we do our exercise training regimens? How do we optimize these for fuel storage and utilization?
Yeah, so this is a great question. It's a great question because in my opinion, the answer, there are so many different answers. Okay, so first of all, what's undeniable is that we need to be aware of our caloric intake. Of course, there's no calorie in, calorie out theory purely as such anymore, but still the total number of calories we're consuming matters. Also, let's say we're consuming 1,500 calories. If these 1,500 calories are made of nutrient-dense food, protein, fibers, complex carbohydrates, they will be really more filling and satisfying nutritionally and emotionally, because a big part of our eating is emotional, than 1,500 calories of something that is processed. So we really have to, some people think that 1,500 calories is not enough. Well, we definitely have to gauge the calories to the person we're talking to, but actually nutritionally valuable food will be enough when we're actually counting and measuring and accounting for the total calories. That is just in general what's not undeniable, right? We have to be mindful of our total calorie consumption. But the other thing is we have to look at our protein. So you have no idea how many patients I see in clinic telling me I'm eating protein. And then we start getting into the nitty-gritty. I have this food tracker, so I start logging their intake into my app. And we look at their total protein consumption or intake per day, and it's not even 0.5 gram per kilo. And while it might not sound devastating, not far from maybe one, but these are patients who think they're eating a lot of protein. So we really need to eat a minimum of 1.2 grams per kilo of protein. And in our older decades, after menopause, increase our protein intake, because without protein, first, we're not going to feel full. Second, we're not going to build the muscles. Protein has so many nutritional benefits that we really need to have our protein in. We need fiber, for sure, also with that. Now, the timing of the food intake and the timing of exercise. So as we mentioned already, as you mentioned, fasted exercise taps into our fatty acid source of energy and fat source of energy. So initially we are utilizing the glycogen that is stored, but if we're fasted, if we don't have much glycogen from an overnight fast, for example, we start tapping into the fat stored. Releasing fat from the liver is huge, for example, in fatty liver disease, even advanced fatty liver disease. Releasing fat from the muscles improves insulin sensitivity within that muscle cell. So not only have you decrease the fat that this muscle cell contains, but you've actually optimized the function of the muscle in relation to glucose. So fasted exercise is actually very important. And it doesn't have to be the most intense. It can be like getting 5,000 steps in the morning, and then maybe later in the day, depending on people's time, schedule, life, it has to be accessible to people, right? And then protein. So you really want to eat your protein after exercise. Make sure there's protein in our system, like in the hour or two after we exercise. So a lot of us feel the pain and the soreness in our muscles when we exercise, like the day after. And these are micro injuries that are happening to the muscles. And as the muscles are recovering from the micro injuries and they're forming new cells, we need to give them the building blocks, and we need to give them enough protein in the post-workout time to just optimize this muscle development and muscle growth and muscle recovery too, you know?
Yeah.
So absolutely.
So do you think one of the reasons like your patients tell you, hey, I'm eating so much protein, is it because of their misunderstanding of which food is considered protein?
I think definitely there's a big part where we don't know what protein is. Most people know that chicken, fish, and meat are protein. A lot of people believe that lentils are protein. They're not protein. They're a carb with a high protein content. But when you put it on a tracker, for example, and you look at how much carb it contributes and how much protein, you need to eat way more lentils, for example, to get enough protein. So that's number one. Number two, studies show that we always misestimate our consumption. So we can think that we can all be, believing that, what I put in my plate is a portion. It might be actually a double portion of rice, or it might be half a portion of chicken. So data, numbers are actually a very simple way of measuring. And for me, if you obtain the data, there will be less frustration. You won't wonder why things are not working. You'll just go by numbers. I need that many grams of protein. This is how much I'll take. I'm just going to weigh it. There's no guessing. There's no questioning. There's no doubting. All these are very negative, not productive thoughts that actually really sabotage people's diet and willingness and ability to be on a diet. But definitely, we don't know what protein is, and we really underestimate how much protein each food provides us.
So you had spoken about a food tracker. Would you be willing to share the app, or then so
Yeah,
people?
there are so many. What I use is MyFitnessPal. The reason I like
Yeah.
MyFitnessPal is that it has a really large database, so
Right.
it's really easy to find the food. You can
Sure.
take a photo and it can estimate.
Yeah.
And it's been really life-changing, even for me. Again, a lot of doctors don't have a background in nutrition. We're not trained. And it was eye-opening to me when I started logging my food and noticing that I was eating, for example, way too much fat and not enough protein,
Right.
So I think information is key.
Absolutely. Yeah, I've used MyFitnessPal as well.
Yeah.
And can you give us examples of good quality protein that people should be taking on a regular basis?
So for me, I believe in unprocessed foods. I always prefer to have a meal than a protein bar, for example, or a protein shake, but there is a role for those for sure. I think in general, first of all, as a general idea, make it simple.
Yeah.
I don't mind eating the same food over 2-3 days, like having a routine. Routine actually takes the guessing out and makes you less likely to take a last minute, random decision, which would not be serving you at the moment, or might serve you at the moment because you're in a rush, but it does not serve your long-term plan. So having regular meals that are on repeat is very easy. Greek yogurt, fat-free Greek yogurt is a really good source of protein. But again, look at the portion size. Some people eat, maybe like less than 100 grams. That's not going to be enough. Lean meat, so chicken, fish, meat. A lean piece of meat is good. A lot of people use nuts as a source of protein, but they come at a high cost of fat. So they have a really high fat content. So I would not use nuts as a source of a protein. What else? I, for example, personally supplement with half a scoop of protein powder every day, and I make overnight oats, chia seeds, half a scoop, and then a little bit of non-dairy milk, just so that the math adds up. But for me, it's just lean, unprocessed, healthy proteins that are, staples, and they were the staples that our ancestors ate, right?
Yeah.
It's simple.
Yeah. And to go back to the point about the lentils and the beans, some of that fiber is still important to
Absolutely
cultivate the healthy microbiome in your gut, because those are the prebiotics that the healthy bacteria use. And even like the healthy fats, right? The healthy fats that we get from avocado, olive oil,
chia seeds.
and even like the fish, a lot of the omega-3s, they have been
Yes.
shown to have really a very powerful effect on cardiac health. So the saturated fats for sure, to limit, but then the polyunsaturated, monounsaturated, those still definitely have an important role.
They have a role. Yeah, and they also have a good role in satiety, right?
Yeah, exactly.
So also and satiety is important whenever you're trying to be mindful of what you eat. If you're hungry, you're just not going to be able to follow any plan. So you just have to choose, carefully your source. Yeah.
Yeah, hunger always wins. So don't.
Yes, it does. Yes.
Yeah. So what role does genetics play in the variations seen with exercise response? Because we see, not everybody responds the same way to exercise depending on the population. So which population in your experience has the highest risk of insulin resistance due to low muscle mass?
So first, I'd like to mention that a lot of not all populations are very well represented in our studies, right? So that's a huge caveat when we look at different, populations and their insulin response to exercise or in general. All right, but definitely, if we look at what affects insulin sensitivity, it's muscle mass for sure. It's even the type of fiber within our muscles. Some people have more type 1 versus type 2, or vice versa. So the type 1 are the ones that are better at utilizing glucose. So not having enough type 1 muscle fibers, for example, even if you have an overall decent muscle mass, increases insulin resistance. That we see in patients of African ancestry, for example. Even though they have a good muscle mass, they also have a high incidence of diabetes and metabolic diseases. We know that patients of Indian Asian descent, for example, have a high prevalence of insulin resistance for so many reasons, actually. Their muscle mass is smaller. They have fat infiltrating the muscle cells. They have also some signaling, insulin signaling, that transcription that is actually different, and that is putting the actual cell in a less efficient state of utilizing glucose, so the muscle cells. And they also have decreased insulin production. So it's also happening at the pancreas level, where we have a little bit less insulin. So our insulin reserve is smaller to start with. And then we have insulin resistance because we have less muscle. The muscle does not know how to respond to insulin and utilize glucose, and the muscle has fat in it. So there are so many. That's why patients of that ethnicity, for example, are considered to have overweight at a BMI of 25 and obesity at a BMI of 27. And this is why you mentioned BMI is not everything. Now we look at waist circumference, which is a huge factor. We see so many patients with a really healthy BMI, but a large waist circumference. Yeah. So, yeah, absolutely.
Yeah, it's so unfair.
It is, but that is why I think this topic or this discussion is important, because some things you cannot change, but there's so much you can change.
Yeah.
And I have yet to think of one thing in our life that would be worse if we exercised.
Yeah, exactly.
Yeah.
Absolutely.
Yeah.
So, Dr. Chia, you have actually shared so much great information with us. Is there anything else you'd like to add before we conclude?
Yes, I mean, I know we talked a lot about exercise, about insulin resistance and exercise, but I also want to remind anyone who's listening to us today that exercise helps our bones. Exercise helps our memory. Exercise helps us be engaged in social activities. When we go for a walk our dog, do something like that. Exercise improves dementia, decreases stroke. There are so many benefits to exercise, longevity beyond just insulin resistance. And once you start exercising, you actually can't stop. That I urge anyone listening to us to just start moving, whatever it is. It's never intimidating. Start with walking. Next, it will be something else you love, and just keep moving.
Yeah, I just love to say that, because I know a lot of my patients, they just hate exercise. And it doesn't really have to be going to the gym. Like you said, take your dog for a walk, use the stairs instead of the elevator, walk instead of taking your car. I mean, that's all very simple ways. Just add up your steps.
Accessible.
Yeah, accessible. I was listening to another physician. I'm kind of blanking on his name, but he was saying how he loves to cook and he doesn't really care to exercise. And even while he cooks, he does like push-ups or whatever in the kitchen.
That works. That works.
So you just do whatever you love.
Absolutely.
Add some movement while you're doing it.
Dance. You can dance. You can, by dancing, you're actually improving even some synapses in the brain, developing new parts of your brain. Just movement.
Coordination, right?
Yep, absolutely. Yes. Yes.
Well, thank you, Dr. Chia. This has been amazing. You've given us a lot of valuable information, and we look forward to having you in future episodes.
I hope so. Thank you for having me, Dr. Brandon.